Lucina, our maternity mannequin and simulator. She is anatomically a female, and so she will be used in both our OB scenarios as well as med-surg. She does have an abdomen that can be put on for just being a female medical patient that has bowel sounds and is not related to pregnancy. So you may see her at various times during your schooling. As far as the features of Lucina, she has dilating pupils, so sometimes the light is relatively bright in these rooms, so it may be just a slight reaction that you see with your pen light, but they should react. She can have an NG tube. You cannot flush or put anything into it, but she may have an NG tube just for more staging and moulage. She has pulses up in her carotid. These are bilateral, and they're either present, absent, or weak. Her brachial pulse is above the bend in her arm on the medial side of the upper arm, so it's a little higher, but that's to allow her to move her joint a little bit better. She has femoral in her groin, and she does not have a popliteal, and she does not have a posterior tibialis. So the only lower extremity that she has is her dorsalis pedis. She can move. She has a little bit better range of motion than some of our other mannequins. She does not have capillary refill on her feet or her fingers. She does have places on her arm for an IV. Now this will be placed by a Sim Center faculty, so you will not be starting IVs on her. You will just use an existing one. If you needed to start an IV, we would have a task trainer for that. If you need to draw blood, we would also have a task trainer for that. As far as her sounds go, she does have breath sounds. She has 2 speakers here and 2 speakers here for her breath sounds. Her heart sounds, she has a speaker in the aortic area, and then she has 3 key-sending speakers on the left side of the chest. She does not have bowel sounds if she is in a pregnant scenario, so whether she is with baby or postpartum, she will not have bowel sounds, and those will be told to you after you check for those. Her abdomen can be distended just like a pregnant lady's, very protuberant. This is actually her postpartum belly, so it's a little softer. The antepartal belly with the baby inside will feel like a pregnant woman's belly. You can palpate contractions on her. It will get hard and soft, just like a real contraction in a real human. You do have the ability to measure fundal height on her pregnant abdomen, as well as do Leopold's maneuver. For her postpartum belly, which this is, you can feel her fundus. It can be firm or boggy. She does bleed, so she can have a slight bleed up to a very heavy bleed. If she has a boggy uterus and you are doing the correct massage technique, then she will firm up and her bleeding will slow down, not meaning that it couldn't return to boggy later. She may have her belts on, which you'll have your monitors on just like you do in the hospital. So this is because we have a pregnant scenario running right now. We have the contraction pattern along the bottom and the baby's heart rate along the top. Those are also shown here in numerical terms. And then these 4 areas are the maternal vital signs. So there's not a blood pressure right now, so you can come here and hit the manual blood pressure and it will show up. If she is not with child, this will the contraction and fetal heart rate monitor will of course be off, and it will either be just her vital signs or telemetry, whatever is ordered for that scenario. Some of the things along here, you have an alarm, so if you want to set an alarm. You also have a mute, so if you have an alarm going off or a sound that you want to silence. And then your Toco 0 has to do with your contraction monitor here. Along with, as all of our wireless and tetherless, meaning they aren't connected to anything, all of our mannequins have compressors in their leg. And you can hear that cycling on and off. It's kind of a vibration tone, and you can feel it in the leg that it has the compressor. So if you're listening for sounds, you may hear that through your stethoscope. I would just advise that you wait until the compressor cycles back off and then continue your auscultating. If you are to give Lucina an injection, you need to use the injection pad in the medication room, and that's covered over on the orientation to that room. You would bring that to the place that you needed to give it, her arm or leg, and give the injection in the mannequin, in the medication pad, not in the mannequin. She does not have injection pads. You'll just hit some areas that are will not accept your needle. She does birth the baby. This is the baby that Noelle births. It does come out crying, or it can be in distress based on what the scenario is. And it will be attached to a placenta and an umbilical cord as well. This is not a full simulator, however. After a couple minutes and the APGARs are assigned, then it will go into kind of a standby mode. And at that time, we may introduce our pediatric HAL simulator, which is just a full baby infant simulator. We do have a warmer over here. However, the warmer does not function. It's more for just a prop. But you will find some diapers and wipes and supplies in the drawer or on the front of the warmer. Like your other rooms, you have your pumps, your oxygen, everything like that. She is on a stretcher, which we have a small video on how to work the stretcher. So you may want to go back and look at that as well.